conus medullaris versus cauda equina syndrome. I myself made mistake in this topic, so I will try to simplify it for you. Watch till end. First understand. So this is the spinal cord, okay, and this is ending at the lower border of L1. Lower border of L1. These are the spinal nerves here. Okay, they are exiting at their respective foramen, but your spinal cord is ending at the level of L1, but these spinal nerves has to exit through their respective foramina. They will traverse the long down. That's why below L1 this will form like a bunch of nerve fibers, and we say it is a cauda equina because it appears like a ghode ka poonch. Okay. This is the lowermost portion of the spinal cord, which is conical portion, and this is called as the conus medullaris, and this contains the following spinal segment S3, S4, S5, C1. Please remember this, okay? And the portion above it is called as the epiconus, which contains what? It contains L4 से S2 segments, okay? This is called epiconus. Now see, if something is hitting here between T12 to L1, it will hit what? It will hit this conus medullaris, and also it will hit the spinal nerve which is exiting here, okay? So these segments will be involved because the spinal segments are involved. This is a portion of spinal cord, and descending fibers are also there. So that's why there will be UMN plus LMN features, okay? And it will be bilaterally symmetrical. Okay, now you see this portion. If something is hitting below L1, whatever will hit, it will hit this cauda equina. This is the nerve fiber bundle. So that's why what will happen, this will affect only the nerve fibers. That's why LMN features will only be there. There will be LMN features, and sometimes S3 will be involved, but S5 won't get involved. This fibers will be involved, this fiber won't get involved. That's why this will be asymmetrical and patchy. Understood up to this? Now see this part. Conus medullaris syndrome, the trauma or disc prolapse can occur at T12 and L1 level, vertebral level, but in cauda equina syndrome, anywhere below L1, if something is hitting or any trauma is there, it can occur. What are the affected part here? S3, S4, S5, C1 spinal segments are here. Here, whatever nerve roots are present below L2 will get involved. Here, LMN and UMN both. Here, only LMN. I made this clear, okay? Here there will be bilaterally symmetrical areflexic flaccid paralysis, but in this cauda equina syndrome, it will be asymmetrical. Now for sensory, look at this. This portion is called saddle. You sit in this portion. This is supplied by S3, and this is perianal portion. This is perianal portion, and it's supplied by S5. Okay, I remembered in this way. We stand on S1, sit on S3, and poop on S5. Okay, you can also remember this. Now see. In conus medullaris, there will be both saddle anesthesia as well as perianal anesthesia. But in cauda equina, I already said there will be some patchy involvement. So saddle anesthesia to hai, lekin there will be perianal sparring. Now look at reflexes. Ankle jerk and knee jerk. Ankle jerk is S1 and S2. Knee jerk is L3 and L4. Sometime when the trauma is at T12 and N1, it can sometime hit this epiconus part as well, where there is S2 and S1 portion. So ankle jerk is lost, but knee jerk is present because it is L3, L4. It will never affect these segments. But in cauda equina, the nerve fibers are affected below L2. So that is why the knee jerk and ankle jerk both will be lost here. Now about bladder involvement. Bladder is supplied by S2, S3, S4, LMN pathways. Okay. In conus medullaris, bladder will be involved, but in cauda equina, it may be normal or can be involved in the late stages only.